How do you train a dog to be calm during endoscopy procedures? Endoscopy procedures are commonly performed on dogs to diagnose and treat various medical conditions. These procedures involve inserting a flexible tube with a camera into the dog's body to visually examine the internal organs and collect tissue samples if needed. While endoscopy is a relatively safe procedure, it can be stressful for dogs, leading to anxiety and potential complications. Therefore, training dogs to remain calm during endoscopy is crucial for their well-being and the success of the procedure. In this video, we will explore effective techniques to train dogs for calmness during endoscopy procedures. 1. Early introduction to handling and restraint. It is essential to introduce dogs to handling and restraint techniques from a young age. By gently handling them and getting them used to being restrained, dogs can become more comfortable with being touched and manipulated. This early socialization will help reduce the stress levels during endoscopy procedures. 2. Counterconditioning and desensitization. Counterconditioning involves associating a positive experience with something that initially caused fear or anxiety. Desensitization, on the other hand, involves gradually exposing the dog to the specific stimuli in a controlled and relaxed manner. Using these techniques, owners can gradually introduce the equipment used during endoscopy, such as stethoscopes and syringes, in a non-threatening way. Positive reinforcement, such as treats or praise, should be used to reward the dog for calm behavior during these sessions. 3. Simulating endoscopy scenarios. To prepare dogs for the actual endoscopy procedure, simulated training sessions can be beneficial. Veterinarians or trainers can replicate some aspects of the procedure, like wearing surgical gloves or gently inserting a small and soft tube into the dog's mouth, to mimic the experience. These simulated scenarios help the dog become familiar with the environment and the sensations associated with endoscopy, minimizing anxiety during the actual procedure. 4. Gradual exposure to the endoscope. The endoscope itself can be a source of stress for dogs due to its appearance and the sensation of having a foreign object inserted into their body. Therefore, it is crucial to gradually introduce them to the endoscope, starting with brief and gentle introductions. Over time, the duration and intensity of exposure can be increased, ensuring that the dog remains calm and relaxed throughout the process. Extensive positive reinforcement should be given during these sessions. 5. Medication and sedation. In some cases, despite extensive training and preparation, certain dogs may still experience significant anxiety during endoscopy procedures. In such situations, veterinarians may recommend the use of sedative medications to help calm the dog. These medications can reduce anxiety levels and promote relaxation, making the procedure more manageable for both the dog and the veterinarian. 6. Patience and gradual progress. Training a dog to be calm during endoscopy procedures requires patience and gradual progress. It is essential to work at the dog's pace, taking breaks and allowing them to relax when necessary. Consistency and repetition are key to reinforcing positive behavior. By slowly building their tolerance and confidence, dogs can eventually become well-adjusted to the endoscopy process. In conclusion, training a dog to be calm during endoscopy procedures is vital for their well-being and the success of the procedure itself. By early introduction to handling, counterconditioning and desensitization, simulating endoscopy scenarios, gradual exposure to the endoscope, and, if needed, the use of medication, dogs can become more relaxed and cooperative during these procedures. Remember to approach the training process with patience and consistency, ensuring the dog's comfort and promoting positive experiences. With proper training, endoscopy procedures can be less stressful for dogs, allowing for improved veterinary care and diagnosis.